Welcome to another episode on Public Health Answers. In our last episode, we learned a lot about challenges in environmental health when facing COVID-19. As Liz Hannah states, if we damage the environment, it will come back and hurt us. She highlights the need of prioritizing environmental health, and I'm therefore very excited to introduce Annalaura Carducci, who will give another perspective on environmental health. She is a professor at the University of Pisa and a member of World Federation of Public Health Association Environmental Health Working Group. Great to have you here with us today. I will start with my first question. How is human health and COVID-19 linked to each other?
It's a very complex answer, but I try to be very, very short. So the first important connection between COVID-19 and health and environment is the origin of this virus that comes from an environment not best preserved. So it allowed the possibility of crossover between species. Another very important connection between environment and COVID and health are the ways of spreading of COVID, because normally the most reported ways of spreading are close contacts. But we know now is a very confirmed way, is the airborne way with bioaerosols in closed spaces, so indoor. We are also discussing about the possibility of spreading outdoors, probably not long distance, but in close distance, even outdoor. So this is a very important way that should be more understood and evaluated. And another important way of transmission, not way of transmission, sorry, but way of studying COVID and SARS-CoV-2 is water spreading of SARS-CoV-2 RNA, because this allows the surveillance, very timely surveillance of cases in low prevalence areas, or after a lockdown to evidence the emission of viruses in communities. And this is the surveillance with sewage monitoring. There is a very wide project in Italy, but also everywhere in the world, in many countries in the world, studying this particular aspect. So I think that these are the most important connection between health and COVID.
How can public health workers target environmental health during COVID-19?
We have possibly a lot of different targets. Mm-hmm. One, I think, very, very important, apart surveillance and study of ways of transmission, is communication. There is a very big need of precise, clear, and continuous information about the ways of spreading, about the importance of this disease, about the ways of protecting towards it, because we can see the so-called infodemic that is a very dangerous spreading of information, not clear, not verified information, and this causes anxiety, but also the neglecting of behavior, of important behaviors like the use of masks, the social distancing, and the seriousness in taking these behaviors. So this is a very important thing that it, affects also the environmental problems, because people tend to also to overestimate the problems and then to abuse with disinfectants, for example. The environmental disinfections very spread without a real need can be a problem. And also the waste produced by the COVID, the medical waste at a population level can be a very important problem. So communication is important, but also the precise and comparative risk assessment. I think that is a time to perform an efficient biological risk assessment, microbiological risk assessment, even on COVID, to compare the possibility of spreading COVID in comparison with the damage to the environment caused by the excessive disinfectant, or also the excessive disposable in the environment of waste.
What has COVID taught us so far between the intersection of health and environment?
Oh, it teaches a very, very curious thing. So, because COVID has stopped countries for some months. Mm-hmm. And we have observed a decrease of air pollution, mainly, and also of the problem of waste, of water pollution. We have seen animals in cities. We have seen a lot of things that we haven't never seen before. We have seen an improvement of the environmental condition, but we know that this cannot be sustainable for the economy. So we should carefully recognize the need of studying and acting towards pollution, and we know that we can do it. We know that we can obtain the new way to reduce pollution. So this is a very important teaching of COVID. On the other hand, things that I said before about the need of a very important and careful environmental risk assessment.
Thank you very much for joining the program and also highlighting the need of focusing more on environmental health during COVID.
Thank you to you.